I'm Dana Krueger. I lead the global healthcare sector at Russell Reynolds, and I'm joined today by my colleague, David Krahe, who is a senior consultant in our medtech practice. And we have the pleasure of spending some time today with Vafa Jamali. Vafa is the senior vice president in Medtronic's minimally invasive therapeutics group and responsible for the respiratory products, which obviously include the ventilator business, and he is leading the COVID-19 response team. So it's really our pleasure to have the opportunity to talk to him today about the leadership challenges that he's facing, both immediately in this crisis and how he's thinking about the future. So thank you, Vafa, for joining us.
Glad to be here.
So Vafa, this is David. As you are front and center with what is, global crisis in terms of product supply and getting several competing demands globally and needing to deal with task force and a huge input or increase, I should say, in output of your products. I'd just love to hear you frame, the impact of COVID-19 on you, your team, and specifically, the key leadership challenges that you and the team have faced.
So when you look at what COVID-19 did to us from a business perspective, obviously anything elective shut down and our offices shut down. So we had a portion of our business that really went into stall. And then we had another portion that essentially was facing unprecedented demand and very limited supply. So how do you manage these two things while working from home and balancing everybody's personal needs with professional needs became quite a challenge. You had people that were really thinking about when does this end and I can get into the next chapter, and others that were really just trying to get air in terms of just the capacity ramp up and all the extra work that we had to do to manage the respiratory needs that were coming up. So that was really what we were faced with. And then how do you manage all this thing when you've got colleagues that have working parents, for example, and they got kids at home now and they're being a part-time teacher at the same time. So it really tests a whole lot of assumptions of how work has to be done and requires you to really sit back and show far more empathy, I think, than you normally would think that you would have to, and a lot more compromise. I kind of think that through this, we've really had to test ourselves in terms of what is a victory. And, these single battles aren't really that relevant when you look at the long term. So playing for the long term has been really, really critical for both our people strategy and our work strategy, whether you're in the respiratory business or in a business that was impacted by the elective surgeries. So a real shift in terms of how you approach different problems.
Have you adjusted your leadership approach in material ways, either in those different business contexts or in the broader context of this crisis?
Yeah, if you're balancing between these two types of businesses, so half of my business is greatly impacted negatively, and the other half has never worked this hard before. So in a sense of having to shift between long-term plays and immediate plays, and then managing inside of a time where really, when you talk about leading through ambiguity, there's never a more ambiguous time than right here. So how do you continue to be decisive? How do you continue to make decisions either for the immediate needs of the respiratory portfolio, or how do you make decisions for ultimately when we come out of this? How do you emerge stronger as a result of your time either planning or just getting greater empathy for what the customer is going through?
And what has been your adjustment? What is the magic answer to those questions you're posing?
So I think when I look back, I look at a couple of things around leadership. I think let's assume intellect and experience being equal amongst leaders. Those able to control their ego through this are going to yield better results. And by ego, I mean how the complexity of a global crisis and this much ambiguity, much more than normal. Nobody really understands all the elements of the situation. Nobody really understands what people are going through. Nobody understands when we're going to come out of it. No one understands how severe it's going to be. Despite that, we still have to make decisions and position ourselves better either today or as we emerge. I think there are some attributes that are preferred in a condition like this. I think that there's some leadership skills that are going to be tested here, and they're not, some of them are quite normal and some of them may be unique. But I would say, if I reflect on it, I'd say influencing skills are much more valuable than direct reporting lines and control. So I think influencing skills in a situation like this, just like a matrix, are more valuable. Listening skills goes with that, and empathy is really, really critical here. I think your tolerance for risk is going to be tested. I think anyone that does a knee-jerk reaction here could over-index or miss. So I think that's one of the pieces that you really got to think about is in this much ambiguity, you need to be able to tolerate a little bit more risk. At the same time, decisiveness is going to be critical here. It's much more important than likability. And by that, I mean, people are looking for decisions one way or the other. You're probably not going to be right, but are you able to adjust and tack quickly when you find a path? And then the last one, which is maybe not so traditional, is kindness. I think we have to be very kind during this, whether we're talking about caregivers, like think about the front line that's going and treating these patients. Think about people that are at home with kids and they're teaching them at the same time. They're your colleagues. Think about the idea that we're all working from home. So should I really make it a 7-day work week, or should I yield you the weekend? I think these are all really, really important factors that we've got to think about. And I think they're all attributes of a kinder, more empathetic leadership style, possibly more materialistic.
Do you think these attributes are here to stay?
I think they should be here to stay. This is just an element of what society looks like. So companies are more matrix. So your ability to control is more your ability to influence than control. So I think that that's definitely a theme that should be here to stay. I think globally, if the virus is kind of analogous to whether a border works or doesn't work, the virus didn't decide whether you had insurance or not, whether you're in this country or that country. It spread. So I really look at these things going, your ability to cooperate, collaborate, become even more important in a world that can really be turned on its head with an event like this. So I think they should be here to stay.
Vafa, tied into that, as we look to the future post-COVID-19 reality, both as a leader, but also as an organization, how are you guys preparing for that post-COVID-19 reality, if you will?
We're going to need to assess what happens post-COVID. And there's some themes that are emerging here. So the themes are patient care. What is going to happen? How are you going to manage patients? Doctor-patient interaction. So the intimacy of a doctor-patient interaction, does that actually change? What's possibly our place as medical device professionals in the hospital setting? I think these are really critical themes that we'll have to look at. And as I look at this, I think what we expect to be there, which is doctors, nurses, technologists in the hospital, they're actually most susceptible to the virus. So how do we support them better? How do our technology enable them to be there when we need them the most, which is what we're seeing right now? That's an element from the caregiver side. Another one that we've really got to think about is patient reluctancy to visit a hospital. How do we triage this group so we don't suffer a higher mortality rate as a result of non-compliance to regular healthcare checkups or managing a chronic disease? I think that my mortality as a whole is increasing right now, possibly because we aren't visiting doctors when we need to. So I think that that's really critical. And I think the more asymptomatic the condition, the more likely a patient will elect not to visit a hospital. So can we find ways to triage them, to either treat them differently in another site of care or get them to come in when their condition merits that? So I think that that's kind of what I look at. I think in terms of the professionals that visit hospitals, undoubtedly there's going to be a more controlled environment, so there's going to be less access. How do we train? How do we in-service? How do we manage the same quality standards of getting a product into a hospital without having that same level of intimacy? And, ultimately from the innovation side, can our technology support a more minimal patient touch environment? So can we create technologies that would naturally just allow for a little more space?
So if I'm hearing you correctly, you anticipate some significant changes in the care model, or at least the opportunity for those changes in the care model to take place. And is there anything specific that you're preparing your team for at this point to be ahead of those potential pivots?
So what we're preparing the team for is, are there ways to remotely manage the relationships, ensure that the products are used effectively when the time is right, give them the education of why it's important that they don't go into hospital settings as regularly as before, but still maintain their efficacy as professionals. So I think we're training that way. We're using a lot of technology to either train, have meetings with end users, or in service. So we're using different types of technologies that I think will probably be another level of innovation that will come post-COVID, whether it be, IT partners partnering with us or ourselves kind of creating new methods of interacting that isn't going to require us to be in the room.
And what about your relationship with other parts of the ecosystem? I believe you're on the White House task force as well, related to ventilator supply. Do you see the crisis as a catalyst for changing the type of relationships you have as a leader in the industry with those sorts of parts of the ecosystem regarding healthcare? And if so, how would you see that permanent change?
So one of the things we saw was the demand for ventilators. At the beginning, it was a very, very large number in terms of how much we needed. And we were making a fraction. So every company was making, a tiny, tiny fraction of what was required. So quickly we realized that unless we got everybody together and allocated ventilators accordingly, it wouldn't happen. So what I presented FEMA with was an allocation model based on severity of disease and based on ICU capacity, for example. This is where the product should flow. That kind of throws out the door the old method of my first invoice is where I ship it to, or where I got the greatest price is where I ship it to. We completely changed that to a needs model. So we changed our pricing model, so we made it standard across the board, so you couldn't have a better, revenue opportunity at one place versus the other. And then we decided to use this allocation model, which would then say, again, based on severity, here's where we go. And then what we suggested was that FEMA would do the same thing. So if they had all these different suppliers, they would also use the same model and ensure that the product got to the right place. And that way, we could use the pooled resources to manage this healthcare crisis, which is, I think, a little bit unique because typically we'll go after our own orders and our own customers. And in this case, we said, throw that out and let's really go after the acuity of need.
And do you see a role for that sort of behavior continuing as we move forward?
I think it can. I think there's complexities that come with it that the crisis sort of allows us to work around some of the complexities. But I still think the complexities of in-servicing different types of products, making sure they're used accurately and properly, making sure you got the right product for the right need. I think those are all elements that'll still have to be woven into this. I think because of the pace that we were moving, we were willing to work on some technologies like an app-based training module, which would allow you on your phone to learn how to use a different ventilator based on what ventilator you were seeing. And that was agnostic to the manufacturer. I think those are as a result of the crisis, but I think the normal part, maybe the more standard businesses will probably operate somewhat less urgently.
Once we go back to quote unquote normal?
Once you go back to a newer normal, I still think that you would probably want to maintain some sort of a brand uniformity in the hospital. So as caregivers come and go, the quality of care can be the same. And I think in this case, we were just trying to fill a massive amount of demand with very limited supply. So I think that was probably a bit of a unique approach. So we had to build models around it, like I said, around training, around in-servicing. Where do you set it up? How do you make sure that this group knows how to use the product when it gets there? And when it gets there, it gets to a patient. It doesn't go to a storage room. So those are some of the unique changes that we had to do with this particular situation.
Vafa, you've gone through now 5, 6, 7 weeks of new normal and crisis response. So as you look back and maybe rewind to the front end of this, anything you wish you knew now that you've lived through it for 6 weeks, or knew then, I should say?
I think the most important part was separating my business from the situation and looking at it as more of a societal issue that we have to participate in. Thankfully, I always felt like this was kind of almost like a privilege to be part of this. In that case, I never really felt overwhelmed by the problem. And then quickly we realized where all the pieces went. But what I would probably have, which is impossible, is some of the ambiguity or some of the unknowns at the beginning are now more known. I still don't know how I would solve for those. So I would tell myself again that, just go. And if you make a mistake, you can easily tack. Just don't get married to a particular path if it doesn't work out. So I think those were good pieces to kind of go with. We learned so much during this that I think it'll be just better lessons for next time. I don't really think there would have been a way to have these in my head already going into the crisis, because again, this was something that we had never seen before. But I certainly learned a lot around managing through ambiguity. And I also learned about the creativity of teams when pressed with this kind of condition. Our innovation cycle just tightened so quickly, and we came up with so many new innovative technologies in a portfolio that really hadn't seen tons and tons of innovation for years. And it just happened so quickly in response to needs. It was so impressive. I just can't say enough of how proud I am of these engineers that stayed up and created these new platforms to help caregivers and patients. So those were all natural benefits of, it sounds very perverse, but some natural benefits of the urgency of the crisis that really created this next wave, which will make us stronger and ultimately make patients and caregivers safer.
Well, Vafa, thank you to, first and foremost, your team for their Herculean response to the crisis. And thank you to you for participating and sharing your experience with us today.
My pleasure. Enjoyed it very much.